Hi, this is Dr. David W. Kim. Today's rhinoplasty blog is about the structural approach to rhinoplasty. Now, historically, rhinoplasty was an operation originally intended to make the nose smaller. And historical techniques, traditional techniques, tried to reach that goal by removing structure from the nose, by taking away bone, by narrowing bone, by cutting away cartilage. Now, these techniques are beneficial in some cases, but in an unacceptably high percentage of cases, sometimes these traditional techniques would lead to problems down the road, sometimes immediate, sometimes delayed. Problems of collapse, problems of nasal airway obstruction, and most importantly, unpredictable results. Now, I am going to speak in a several-part video blog about different components of the structural approach to rhinoplasty. This is my approach, and this is what I believe is the best way to prevent problems. I'm going to start with this video that has been out there on the internet showing our poor poster child of bad rhinoplasty, Michael Jackson. You know, when he was young, he had sort of a natural but full nose, and over time he had more and more rhinoplasty operations, which created increasing weakness to his nose. The soft tissue scar and contracture led to eventual collapse, and shortly before his demise, he had a very damaged nose, which has been imprinted in the consciousness of many due to the coverage in the media. So this lecture is going to talk about the basic structural anatomy of the nose so that we can understand the principles of structural rhinoplasty. Ideally, every rhinoplasty should lead to a good cosmetic and functional outcome. The results should be predictable, the results should be long-lasting, and there should be minimal complications, but really this doesn't happen all the time. My practice is almost 40% revision, and I know firsthand that rhinoplasty, when done not in a thoughtful, structurally minded way, can lead to mixed results, lead to unpredictable successes. The improvements may be short-term with complications down the road, and there may be problems breathing and function of the nose. So why is it that this operation is so hard? Well, really, it boils down to several things. The nose is very complicated in terms of its anatomy, and there's a tremendous amount of variation person to person. The skeleton, the bone and cartilage of the nose, which is what we're trying to change, is not very compliant. There's resistance there, and trying to force too much change leads to problems. The skin that overlies all of the nasal skeleton undergoes this contracture, and these postoperative forces can cause shrinkage of the nose. So unless the nose underneath is made strong, problems will ensue. The nose is a very complicated three-dimensional structure, and it's very unforgiving of even small imperfections because the nose sits right in the center of the face. There is incredible human diversity. There are so many different noses, and the nose can make such an impact on the overall impression of an individual. Now, this is Nicole Kidman. On the left is her in real life, and on the right is her with a nasal prosthesis from the movie The Hours. And you can see how that just totally throws off the composition of her face. Noses can have a tremendous amount of variability. Barbra Streisand with a very strong nose, high bridge. Linda Evangelista, who was once rated by many plastic surgeons as having the most beautiful face in the world, she has a fairly unique and unusual nose that doesn't conform necessarily to the standards of what an ideal nose should be. Halle Berry, Jennifer Aniston, these women have very different noses but are also noted to be extremely beautiful faces. Models in fashion magazines have quite a variety of noses. I performed a study a few years ago looking at the trends in magazines, and over time, interestingly, the noses have become wider. When you compare the width of the tip from the year 2000 to 1980, a wider nose is more in vogue. Now, there are a great deal of variety of noses. These gentlemen, famous actors, chose not to do anything with their nose. They're sort of their signature features. Adrian Brody, Karl Malden, and of course Mr. Wilson, who has a very unique nose, but this sort of adds to his character and flavor. What we don't want is rhinoplasty to lead to complications. I don't know firsthand if Carrie Ann Moss ever had surgery, but the right side of her nose looks fairly collapsed. Rhinoplasty should lead to predictable results that avoid this type of collapse. In the next series of lectures, we're going to talk a little bit more about the details of how to avoid problems while producing predictable, structurally minded